Good afternoon, everyone. This is Cynthia Robinson with Department for Public Health, and I'm here to go over some of the updates for ICD-10-CM 2020 updates that actually went effective October 1st of 2019, because they're actually these updates I'm going to go over are effective as of October 1st until the next September 30th of 2020. So just so you all know, this is what I'm going to go over for you. So I guess we'll just dive right in. So the first thing that I wanted to go over is the 2020 guideline changes. And I've pulled out a lot of this information that is what I feel like is really pertinent to health departments. So for that reason, that's why it's going to be a very minimal webinar today. It's very small, not a lot going on with it. The first one that I wanted to go over here is the guideline changes, and it is pertinent to Chapter 21. It's the factors that Chapter 21 is factors influencing health status and contact with health services. That's which everybody knows we use a lot of the Z codes. The Z codes have basically replaced what we used to use in ICD-9 as the V codes. So I just wanted to go over the BMI codes that should be assigned when there is an associated reportable diagnosis. So this is actually something that was changed for the guidelines for this year, for 2020. The main thing is do not assign BMI codes during pregnancy. So that's just one of the things that we wanted to go over. I wanted to go over with you all just to make sure that you're aware of it. Okay, so then the next thing that I wanted to go over with you all is, again, still in Chapter 21. And this is where we have the Z71, which is persons encountering health services for other counseling and medical advice not elsewhere classified. The note down there at the bottom is a code that actually is new for this year, but it's code Z71.84. It's encounter for health counseling related to travel is to be used for health risk and safety counseling for future travel purposes. Okay, so this slide that I have in front of you now is I just wanted to show you all, there really wasn't a whole lot that changed this year, and we're kind of lucky with that, so that's good. The additions, we only had 273 additions. We had 21 deletions, and then there were 30 revisions. So, and I wanted to give you, because I know you all underestimate how much you all have to deal with ICD-10 and the diagnoses that we have to deal with. So I wanted to show you all how many you all are actually dealing with on a daily basis here. I mean, I know you don't touch all of them, but there's quite a few out here. You have 72,184 codes that are in ICD-10-CM that we actually use. I mean, now, here's the thing. I know you don't use a lot of those, but you still have to know that they're there, you know, and you have to know what all they do and all that good stuff. So it's just one of those things that I wanted you all to be aware of, to see how, just to, you know, I mean, you deal with that many codes, that's crazy, you know, but just know if you have questions or anything like that, you can always contact me for that. All right, let's go ahead and dive in on this, and we'll start with the first. It's new revised note that was changed, as far as this is a big one for TB. A18.4, which is tuberculosis of the skin and subcutaneous tissue. The main change on this is the excludes to note was changed. It's something that if it involves these two diagnoses, then you do not want to code this particular code, the A18.4, because this is an excludes to note, okay? So if you have this on this, then you don't want to code that, the lupus and then the systematic lupus. So you would go to the actual code for that particular diagnosis. But again, like I said, that's just a small change, just a revision basically on that. The next thing that I have is, again, a coding note change. And this is where the J06.9, acute upper respiratory infection, unspecified. So the main thing that changed for that is use additional code B95 through B97 to identify the infectious agent if known, such as RSV. So, and I've actually got your code there for RSV of B97.4. So just something to think about. That's one of those things you have to use the additional code to identify the infectious agent if you know it. On that one, that's mainly the big thing that changed for that. All right, so then the next thing that we have is in Chapter 14, diseases of the genitourinary system. This is, again, a coding note change. This is the N39.0, which is urinary tract infection, site not specified. Okay, so if that's the case, then you need to look at this excludes one note and make sure that, you know, if there is actual sites that are specified, then you're going to have to get a little bit further into it. So that's just something to think about. I'm going to move on. I'm staying in Chapter 14 still for the diseases of the genitourinary system. These new codes are actually, again, they're brand new for 2020. This is breast lump in overlapping quadrants, okay? So this is when you have a breast lump that may be in 2 different quadrants, then you're going to use these codes. So I actually put a note at the bottom there just telling you, hey, this is what this means. Just because I want to make sure that you all are very equipped to not necessarily diagnose, but to associate the correct symptom with the issues. So, all right. So N63.15 is unspecified lump in the right breast with overlapping quadrants, not with, but overlapping quadrants is essentially what that means. So it could be in the upper and the lower quadrant, or, you know, whatever. Also, N63.25 is in unspecified lump in the left breast, overlapping quadrants. So, okay. We have a new code, which I don't know if this is really something you all will use a whole lot, but I just thought I'd throw it in here just because I wanted to make you all aware of it. It's a new code. It's post-endometrial ablation syndrome, and the new code for that is N as in Nancy 99.85. So, and I've actually listed some of the symptoms that are associated with that, and also treatment that's listed there with it too. It's something that I pulled out of information that I actually received when I did my ICD-10 updates with my training with that. So I thought I'd just relay that information. I figured, you know, too much information is better than not enough, right? So that's why that is there. And we'll move on to, actually, we're going to go to Chapter 18 now, which is symptoms, signs, and abnormal clinical and laboratory findings, NEC. So not elsewhere classified, of course, was what that NEC stands for. There are a few new codes on this chapter. R11.15, that is your vomiting syndrome unrelated to migraine. So there's that. And then you have your R82.81, which is actually brand new. They've actually finally defined that particular road, which is, I think it's actually pronounced Pyra. And then you also have the R82.89. And I actually wanted to go over what the Pyra, I wanted to go back, sorry. Pyra is a laboratory finding of white blood cells in the urine. So it most commonly most commonly occurs in urinary tract infections. So that's kind of one of the things that I wanted to just pop in there just so that you all could see that too. All right, so then we're going to move on to chapter 21. Factors influencing health status and contact with health services. So I pulled out the best I could what I think you all will use the most, and the first one is a new code for, and this is a really big one for us. It's Z1111.7. So, and that actually, again, let me say that one more time. It's Z11.7. And it's encounter for testing for latent tuberculosis infection. So this is a big one for us. So just something to keep in the mindset there that we need to make sure that you might even want to add that to your possible cheat sheets that you have. It's just one of those things that it might come up. So, and of course, you can always contact me if you need that too. So another new one that we have is the actual diagnosis, and it's a status code is what that is. I put that in there. It's still a new code, but it's really more of a status code, which is Z22.7. And that is actually basically saying that patient is latent tuberculosis. So that's just something that I wanted to put in there. I have another one down there at the bottom, but I don't know that you will use a whole lot of that. So let's move on to the next note that we have here. Okay, this one actually is still in chapter 21. And this is a revised note because what they've done is actually changed the Z68. The BMI has revised the age ranges for adult and pediatric BMI codes so that, it doesn't overlap, essentially. The BMI adult codes are for persons 20 years of age or older. The pediatric codes are for persons 2 through 19. So if you have a BMI 2 through 19, you're going to use the pediatric. 20 and above, you're going to use the adult. So just thought I'd go over that with you because that's kind of a new revision within ICD-10-CM. Okay, and then I give you some new codes that actually were done this year for 2020 that might come into play for you. I'm not sure. But I just thought I'd give them to you. Z01.020. And this is an encounter for exam of eyes and vision following failed vision screening without abnormal findings. The Z01.021 is with abnormal findings. So that's something to just so that you know about that. And then we have this other code that I was talking about earlier that is Z71.84. This is an encounter for health counseling related to travel. So that's where I was talking about that one. So, but that is a new code for 2020. And then we have several new codes for personal history of. There's, as you can see, quite a few that are listed there. I'm not going to go over all those because I think you can read just fine. But the main thing I wanted to point out here is the Z86.15, which is personal history of latent tuberculosis infection. And honestly, this is why It was very simple, very small this year, not a lot of changes, revisions. Like I said, I went over with you exactly how many of what is in there. But again, if you have any questions, you'll know how to get a hold of me, I'm sure by now, I hope, anyhow. But if not, right here's my information. And you can just get a hold of me either through the help desk, or you can contact me directly through my email is fine too. So I also have the LHO website listed here too, just in case you ever needed that too. So some people tell me that they don't even have that. So it's a pretty good tool. So I just thought I'd include it on the slide. All right. Thank you.